Welcome, Dr. Mayfield, and congratulations on being elected chair of TFAH's Board of Directors. I know that the board members and our staff are thrilled to have your leadership on the board, and we're looking forward to our important work together. Thank you so much for being willing to serve in this important role for the organization.
Dr. Gracia, thank you. It's truly an honor to be the chair of the Board of Directors for Trust for America's Health, such a fantastic and useful nonpartisan public health policy research and advocacy organization that's philanthropically funded. I look forward to continuing the long-standing mission of TFAH to promote optimal health for every person in every community with a focus on prevention of illness and injury as a national priority. So thank you.
Thank you, Dr. Mayfield. Well, let's begin. Can you tell us, what are you most excited about as you begin your tenure as TFAH board chair? What are some of your goals, both in the short term and the long term?
Absolutely. This is such a great opportunity to further advance health equity policies and practices in our nation. And I'll take the short-term question first. Of course, fulfilling the fiduciary role as board chair and ensuring organizational stability through sound, ethical, and legal governance is very important, and that is a mission that will be accomplished with the Board of Directors along with the organization in support of TFAH's mission. I am most excited coming up about our long-term planning. We will be doing a 3 to 5 year strategic plan with the organization and the Board of Directors, looking at our current work and exploring next steps. So that's what I'm most excited about. Thank you.
That's wonderful. And we look forward to the experience that you're going to bring certainly into that process in the short term as well as the long term. Dr. Mayfield, you were the first African-American, the first woman to hold the position of State Public Health Commissioner in Kentucky. What are your reflections on those firsts?
Well, of course, it's a wonderful opportunity to serve as the State Health Commissioner and drive needed programs, but there's also something else very important about those two facts you just mentioned to keep in mind, and that's it's our responsibility to continue to build diverse and inclusive workforces so that first won't become an only.
And how does that increase in that diversity and inclusion of the workforce then help to address the health and well-being of communities that are being served?
Right. Well, it can help you by being more relatable to the communities that we serve. When we think about COVID and reaching out into communities, we found that there is a more timely and receptive, if you will, response to people who perceive you as being more relatable to them.
As a former state health commissioner, and especially at this critical time for the future of public health, your experience and your perspective are so beneficial. What would you say is working in public health and what isn't working?
Well, let me just say that, yes, I agree. It's a critical time for public health, the future of public health right now. And there are many things that are working. As you know, public health is very broad, from environmental, such as food safety, then programs on chronic diseases, women's health, preparedness. There's so many individual elements within those programs that are working, but there are significant challenges right now. And I like to just focus on 3 real quick challenges that the public health community is facing. Sustainable funding. Public health needs sustainable funding adjusted for inflation to maintain its current and be prepared for what's to come, both on climate and viral threats and dealing with chronic diseases, and to build a robust workforce. And we talk about partnerships and to engage in building multi-sector partnerships. The second, data collection. We can't do anything without our data, and we need real-time exchanges to facilitate swift responses. And third, communications. Communication has to be accurate, timely, and relatable to the public, and reaches areas of the public experiencing stark health disparities.
You have worked in both the public and private sectors during your career as a health executive. What would you say? Are you seeing how the healthcare and public health systems are working? Are they working together to the degree that they should be?
To the extent they should be, no. We can all do more. And specifically addressing the spectrum, again, of social determinants of health. Healthcare systems can do more from the screening aspect of the social, economic, and addressing the digital divide issues in clinical settings. And we know that super determinant on digital divide is very important, because when telehealth is used, there are people that are unable to participate for various reasons. It could be a lack of broadband, but we did see that in the infrastructure bill, but it's not implemented in every area yet. There are so many social determinant of health screenings that need to be done and managed in order to maximize the clinical care that is being issued. That's one thing. In-house services, maximizing community investment and relations as an anchor institution, and partnering with community-based organizations. And public health can collaborate with these health institutions to offer best practices for screening on social determinants of health. Public health can help drive multi-sector collaborations with anchor institutions and provide the evidence of need and demonstrate policy and efficacy that promote health by addressing the social determinants of health. Our healthcare sectors and public health are both needed to address our basic human needs, which are the social determinants of health. And our clinical side, we need them to respond to the individual needs, and public health can help meet the needs of the overall population.
What would you say then, just given your experience, the healthcare system needs to do to move from that primary focus on treating disease to then enhancing its focus on prevention and public health, population health?
Right. Dr. Gracia, when I talked to CEOs recently in the healthcare system, and one of the things that they're stressing, and that we don't even have to talk to them, we see it in the papers, we understand our healthcare systems in our nation right now are stressed. There are worker shortages, high community illness, and a lack of sustainable funding to meet the current challenges and any future threats. They cannot go it alone. So we need and expect our healthcare systems to address our immediate health conditions at the individual level, but strengthening primary care will enable health systems to move more into prevention, but this will require supportive policy mechanisms going upstream, a systems change approach for the entire healthcare sector. And that would include payers, that would include public health practitioners, and public-private sector, and making those and supporting federal policy changes.
So Dr. Mayfield, you were most recently the director of the U.S. COVID-19 Response Initiative for Resolve to Save Lives, and I'm sure you have a long list of takeaways from that experience. Can you share a few of them with us?
Yes, there is an exhaustive list of takeaways, but just high level. As we know, Dr. Gracia, COVID really put a spotlight on things we already knew, the health inequities. So the strategies to reduce health inequities require upstream and downstream policy changes and partnerships, public-private partnerships. Healthcare systems can't engage in the entire spectrum of health. Public health alone cannot do it. We have to bring in all the partnerships to do that. And there has to be funding to support this, data, again, going back to data, but nearly real-time exchange of the data so that meaningful interventions can be done very timely. And again, communications. That's so key, how we communicate, not just to our own practitioners and within our community, but reaching out to areas where there are stark health inequities. So those are the high level things that I wanted to point out that we've seen with COVID, and they're true for hypertension. They're in my last role with Resolve to Save Lives with you, Director of US Partnerships. We engaged in hypertension and policy. So we know the value of data, communications, and partnerships.
Are there any closing thoughts that you'd like to share with us?
Yeah, I just want to say, thank you to Dr. Gail Christopher, who is the immediate past chair of the TFAH Board of Directors, for her stellar leadership and guidance. And also to our board of directors for supporting me in this new position. And I'm looking forward to strategic planning with them and continuing our next steps. I want to thank the person who originally oriented me to TFAH, and that's John Auerbach, the former CEO. And of course, you, Dr. Gracia, and the organization for your support. And it's so exciting to keep planning. And I would be remiss if I didn't mention our funders. We could not do any of this work without them. So I'm hoping they'll continue to support us and be with us along this journey as we work to make every individual and every community healthy, with a focus on prevention of illness as a national priority.